Hi, welcome to our telehealth video information series. I'm Garvin, and this video is on Sofradex. So what is Sofradex used for? It's used for the inflammation of the outer part of the ear canal. Short-term treatment of eye inflammation when preventing bacterial infection is also required, for example, after eye surgery. How does Sofradex work? Sofradex eye and ear drops contain three active ingredients: dexamethasone, Framycetin and Gramicidin. Dexamethasone belongs to a group of medicines known as corticosteroids that are used for reducing inflammation. Framycetin and Gramicidin are antibiotics that are included in these drops to prevent infections with bacteria. Corticosteroids are hormones produced naturally by the adrenal glands that have many important functions, including control of inflammatory responses. Dexamethasone is a synthetic corticosteroid that can be administered into the eyes or ears to decrease inflammation. Inflammation can occur as a result of allergies or from irritation or trauma. It is caused by the release of substances that are important in the immune system. These substances cause blood vessels to widen, resulting in the affected area becoming red, swollen and painful. Corticosteroids work by acting within cells to decrease the release of these substances in a particular area, thereby reducing swelling and redness. Framycetin belongs to a group of antibiotics called aminoglycosides. These antibiotics have the ability to kill a wide variety of bacteria. Framycetin works by affecting the production of certain proteins by bacteria. These proteins are necessary for bacteria's survival. Framycetin causes the bacteria to produce abnormal and faulty proteins, which ultimately kills the bacteria. Gramicidin is an antibacterial medicine that kills bacteria in a different way. The combination of these two antibiotics kills a wide variety of bacteria that may affect inflamed eye or ear conditions. So how do you use Sofradex? This medicine is for use in the eyes or ears only. It must not be taken by mouth. Wash your hands before using the drops. It is important to follow the instructions given by a doctor. If using the drops for the eye, the usual dose is 1 or 2 drops into the affected eye up to 6 times a day. For use in the ears, the usual dose is 2 to 3 drops into the affected ear 3 to 4 times a day. You should not use these drops for longer than 7 days unless advised by your doctor. Consult your doctor if after 7 days of treatment with this medicine there is little or no improvement in your symptoms, or your symptoms get worse despite treatment. These drops contain a preservative that helps to keep the drops sterile while they're in use. However, the drops should be disposed of 4 weeks after first opening the bottle, because by this time there may have been contaminated with germs that could cause eye or ear infections. You may find it helpful to write the date of opening on the pack and dispose of carefully, preferably by returning the bottle to your pharmacy when you're finished. Can you use Sofradex while pregnant or breastfeeding? The safety of this medicine for use during pregnancy and breastfeeding has not been established. The medicine may be absorbed into the bloodstream after application into the eye or ear and can cross the placenta and pass into breast milk. It is not recommended for use during pregnancy or breastfeeding unless the potential benefit to the mother outweighs the risks to the baby. So what are the side effects of Sofradex? So the following are some of the side effects that are known to be associated with this medicine: irritation, burning, stinging, itching or dermatitis of the skin around the eye or the skin of the ear. Intensive or prolonged application of corticosteroids to the eye may lead to thinning of the cornea and glaucoma, damage to the optic nerve, development of eye infections or the formation of cataracts. Your eye specialist will want you to have regular eye checkups to monitor for these types of side effects if you use this medicine for longer than a week. So the side effects I've mentioned may not include all the side effects reported by the manufacturer. For more information on any risks and other possible side effects, Need to read the patient information leaflet that comes with the medicine, or speak to your doctor or pharmacist for more. How can Sofradex affect other medicines? No specific studies have been performed by the manufacturer to determine if this medicine interacts with any other medicines. It is not known how much, if any, of this medicine is absorbed into the bloodstream after being administered into the eye or ears, which makes it difficult to predict interactions that may occur. You should tell your doctor or pharmacist that you are using this medicine before using any other medicines. And if you're using more than one type of eye drop, you should administer them at least 5 minutes apart to prevent the subsequent drops washing away the first drops. And you use eye drop or gels and ointments last. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below, or contact me through our website, mytelehealth.info, or call into Lynch's Pharmacy, Douglas, Cork, or ring 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.